Dentists are supposed to fix your teeth, not accidentally pull out the wrong tooth or potentially choke you with some gauze that they're shoving down your throat or light your mouth on fire. These are real cases of dental procedures gone horribly wrong. So I'm gonna go over some of these shocking dental horror stories that actually happen. And I'm also gonna go over what we can learn from them so that they never happen again. Let's get into it. In March 2015, 6-year-old Caleb Sears went in for routine oral surgery. He had to get a tooth taken out. Like many procedures, the oral surgeon used a combination of sedative drugs. He used a combination of fentanyl, Versed, and propofol to help Caleb sleep throughout the surgery. But within minutes, something went horribly wrong. Caleb stopped breathing. And by the time anyone noticed, it was too late. And his brain had been deprived of oxygen for too long. Unfortunately, he passed away. Obviously, his parents were devastated. And what they were most upset about was the doctor was doing the surgery at the same time as doing the sedation. In most states, it's recommended, and in some it's even required, for sedation cases to have two providers. One focusing exclusively on the sedation and the other doctor doing the surgery, because it's so hard to do both. You cannot focus on doing your surgery, but then also focus on the sedation and monitoring the patient's vitals at the same time. In this case, the same provider tried to do both, and unfortunately, the child passed away. Now imagine this. You're going in to get a tooth extracted, and the dentist pulls the wrong tooth. It sounds unthinkable. Like, how do you take out the wrong tooth? Well, it happens more often than you'd expect. Even I was shocked at how often this happens. One study found that the prevalence of wrong tooth extraction was over 21%. That's over 1 in 5 dentists that are reporting making the mistake and taking out the wrong tooth. Now, what is the most common cause of this? Miscommunication. I know a dentist who actually did this early on in his career. He took out the wrong tooth, realized his mistake, and actually put the tooth back in. He re-implanted that tooth. Somehow that tooth survived. Now, that was years ago, so I'm not sure what the status of that patient is now with that tooth, but this is why we do our pre-surgical verification. You have the dentist, the assistant, and the patient all awake and understanding which tooth you are taking out. And the dentist even says out loud, "We're taking out this tooth," right? To the assistant, and needs a confirmation before they start. All this redundancy seems kind of stupid, but it can actually prevent a lot of issues. Now, how about this one? A patient went in for a routine dental procedure one day to get some of their teeth extracted. They went out of the procedure with 13 teeth missing, except there was one problem. The person who pulled out those teeth wasn't even a dentist. It was actually the dental assistant. Now, was it the case that the assistant was just helping out the doctor and helped pull out those teeth, which also is not allowed, by the way? No, it gets even worse. The assistant used discarded anesthesia to put the patient to sleep so that she could get the teeth out. And on top of that, she also broke into the office multiple times to steal money. She stole a total of $23,000 in cash and checks. Luckily, she was caught and arrested. And she was also charged with practicing dentistry without a license. I'm sure that carries a hefty fine. So I hope that $23,000 was worth it. Moral of the story, always know who's treating you and make sure you trust your provider. This next one's gonna sound pretty crazy. It involves a fire inside of someone's mouth. Yep. You heard that right. A fire inside of the mouth. A 72-year-old woman in Illinois was undergoing routine dental treatment. All of a sudden, a spark emitted and lit a fire inside of her mouth. The result, she had to go to the hospital and ended up with second-degree burns in her mouth, throat, and lungs. How did this happen? Well, during routine dentistry, we use a high-speed drill. Now, these handpieces spin really fast. They can spin up to like 450,000 RPM, or rotations per minute. And this generates a ton of friction and heat. Now, this lady also had nitrous oxide during the procedure, or in other words, laughing gas. This is something we put over the nose, and it releases a mixture of nitrous oxide and oxygen. Now, anytime you involve oxygen, things get more flammable. And in her case, she had a little leak that was spewing that oxygen close to where that handpiece was. And this led to a very unexpected fire in the worst place you could imagine. But this is exactly why training matters so much. We know these things generate a ton of heat, and we know they generate a ton of friction. And we also spray a ton of water when we're doing dentistry because of this. You might think like, why are you drowning my face with all this water? Are you just trying to annoy me? But no, everything has a purpose. All right, this next one is more so on the patient than the actual dentist. One patient reported that they tried to re-cement their own crown. The only thing was they didn't didn't use any dental cement that they had lying around because no one has dental cement lying around. Instead, they used the next best thing, super glue. I know what you're thinking, this person is a genius, right? Like, how come we didn't think about doing this ourselves? We saved a visit to the dentist. We don't have to use any of their expensive ingredients and stuff like that. We can just do it at home. I've heard of patients wanting to use super glue on their own teeth at home if something like this ever happens. Please don't do this. The crown stayed on the tooth. That wasn't the problem. But the patient had extreme burning pain. Not just with the tooth, they also had problems with their gums, and they developed a chronic infection. Eventually, they had to cut the crown off, and the tooth had more damage. Moral of the story, dental materials exist for a reason because they are designed to be used on your teeth and in your mouth and around your gums. And super glue is not one of them. All right, this next one is actually pretty sad and pretty shocking. Now, some of these were sad in the first place, but let me tell you about Jared Wakefield. He was a healthy 22-year-old who went in for a routine dental extraction. The only problem was he never walked out. Now, was it because the dentist gave wrong medication, or they weren't able to control the bleeding from the extraction, or some other surgical mistake happened? No. During the procedure, the dentist put a throat pack, which is basically this piece of gauze that sometimes we put in the back of your mouth to catch any particles. For example, if we have a really small tool, if we drop something, we want it to drop into this gauze so it doesn't go down the back of your throat. Or if the tooth comes out, we don't want you to swallow it. So the whole point of this throat pack is to prevent you from choking. The problem, this throat pack went too far. It went down the patient's throat, and the doctor wasn't able to retrieve it. So this patient's oxygen supply was completely cut off. They ended up calling 911. Unfortunately, by the time the paramedics came, it was not looking good. He was pretty much brain dead, and then he died not too long after that. In another case, John Santilli went into cardiac arrest after the same thing happened to him, after some gauze was lodged in his throat. Luckily, he survived, and he was even quoted saying, "I am so lucky to be alive," afterwards. All of these aren't just some freak accidents. They're pretty easily preventable, especially if you have proper surgical checklists and protocols. Now, these stories might seem terrifying, but they all teach the same lesson. Even the most minor procedures carry some risk, and if certain protocols aren't done correctly, some major problems could happen. Communication, double checking, proper training, all are super important, even for the most minor procedures. And if you're in the dental field watching this, just another reminder to make sure you stay thorough and stay vigilant. And don't be afraid to ask questions either, whether you're someone that's young and learning, or whether you're a patient who is about to get a procedure done. Now, thank you guys for watching. I hope you found this video interesting. And if you haven't already, make sure you hit that thumbs up button and subscribe to my channel below, and I will see you in the next video. Have you ever wondered how a dentist actually does a filling, or wanted to see it up close? Well, I actually saw this video pop up, and we're gonna react to it together of how a dentist actually fills a cavity from the very beginning to the very end. Let's go.
Today we're going to discuss the steps involved in a Class 1 dental composite filling, which is a common procedure used to restore decayed